I wanted to talk a little bit today about the levels of disinfection. So one thing that is important in stopping the spread of any disease is making sure that you're using the proper tools or supplies in order to achieve the best protection for you and your client. There are 3 levels of disinfection. So there is sanitation, disinfection, and sterilization. And sterilization is not something that we can really do in our practices, and disinfection is the highest that we can do in cleaning and disinfecting our treatment rooms. So some important definitions that we have here are, one, the very first thing you have to do is actually clean. This is the process of removing debris. So if you were to spill something on the floor, for instance, if you spill a glass of water, you pick up that water first, and then you would wipe it off, maybe with a paper towel, and then let's say it was something that was sticky, you're going to come back with it, right, to clean with what would be a surfactant to pull, or detergent to pull that out. If a surface is not clean, it cannot be disinfected. So when you pull your plate out of the dishwasher, for instance, and it still has food on it, the food's disinfected, but what's underneath has not been able to, just as an idea as why you have to clean before you disinfect.
So with regards to massage, Amanda, cleaning would be getting the oil off of our tool, or getting the oil or our products off of our surfaces.
Correct.
To relate it to our profession, yeah.
Absolutely, yeah. Yes, so anything that our clients would have come in contact with, anything that we come in contact with, you know, if it's muddy out, you need to make sure to mop your floor before you disinfect it. Universal precautions that we already practice in our profession is the system of infection control designed to protect persons from exposure to blood and bodily fluids. So the World Health Organization has their best practice for hand washing. This has been something that has been readily available pretty much to everybody since this has started. So soap and water, 20 seconds, you know, soap and warm water, I should say, for 20 seconds is the most effective way of washing your hands at this point. Sanitation is the chemical process for reducing the number of disease-causing germs on clean surfaces. This is considered a safe level. So sanitation, we're using hand sanitizer, we're using Clorox wipes for door handles, things of that nature. I would like to add that when you look at, there is a difference in contact time with sanitization and disinfection, which will determine which is which. So it's important to read the labels of your products. I'll get into that in a little bit. Disinfection is a chemical process using specific products on environmental surfaces to destroy the harmful organisms, except for the bacterial spores. And that's where sterilization comes in, is the only way bacterial spores are sterilized or are rid of is through sterilization or very heavy chemical process. There are 2 methods in decontamination of spaces, items, tools, things. And these are just some prevention principles that we can be practicing, not only as massage therapists, but out in the real world. Decontamination method 1 is cleaning and then disinfecting with appropriate EPA registered disinfectants. Now this is important because the EPA has tested these disinfectants and they have an efficacy level proving that they've been able to kill the bacteria or viruses, whichever that they are approved to do so. So decontamination method 2 is cleaning and then sterilization. And this would be something that we can't do in our treatment rooms, but would be optimal for something like an operating room or a surgical situation. So going into prevention principles, decontamination method 1 would be industry best practice for massage therapy. So first thing that you would do is that you would clean your area. Make sure that you are getting all of your surfaces, your flooring, your door handles, windows. Just do a thorough deep cleaning of your office. You're going to make sure that when you're cleaning, what you're looking for is the removal of all dirt and debris. So washing, again, is going to be the key to this. So wash your tools, your implements, your sheets, all of your equipment. And you can use a scrub brush, like a nail brush, for instance, to scrub away all debris should something be stuck on. It's also important to make sure that you're using some type of cleaning solvent. So an antibacterial soap, for instance, is going to be the way that you're going to create some slip in order to create friction and remove the debris from your items. Once your items are actually clean is when you begin the disinfection process. So again, if something has some bit of debris on it and you were to disinfect over it, that's not disinfected. The debris is disinfected per se, but the item underneath it would not be. So the process of disinfection is going to eliminate most, but again, not all, of the microorganisms on a non-living surface. So this would be your countertops, this would be your sheets, this would be your face cradle, this would be your handle to your door or your washer and dryer. These are going to be the types of things, the handles of the sink in your bathroom, you know, the toilet, anything that somebody might touch that is not a living surface, so like plants, for instance. Disinfection is the effective way of controlling this spread of items on surfaces, tools, and equipment. And of course, I said before, making sure that you are using an EPA-registered disinfectant. The efficacy is important when you are trying to rid of disease and viruses. One other thing I want to point out is that it's really important to read the label. So these in particular, maybe you guys can see, I'll bring it over here, are the Clorox disinfecting wipes. And what I think a lot of people do is they don't read the label, they just have seen other people wipe stuff down. But I'm going to read to you a couple of things that you might know, and this goes into the point of the difference between sanitation and disinfection. So, direction for use. One of the things it says here is this is not for cleaning or sanitizing the skin. Do not use as a diaper wipe or for personal cleansing. So if you're using this to wipe down your face or using it to wipe down your hands, it's not meant for the skin in particular. This is, again, disinfectants are for hard surfaces. So to disinfect, you are going to disinfect a hard non-porous surface, wipe the surface to be disinfected, use enough wipes to treat the surface to remain visibly wet for 4 minutes. So as many wipes as it takes to keep your surface wet for 4 minutes. Then you let your surface dry, and for highly soiled surfaces, again, clean it first. To sanitize, which is a level down from disinfection, you are going to wipe the surface with enough wipes on the treated surface to remain visibly wet for 10 seconds. Okay, let the surface dry, and for highly soiled areas, clean first. So this is just your Clorox wipe. There are a lot of other disinfectants out there, right? So there's Lysol that people are using, there's barbicide that people use and Cavicide that people use in salons. So that's one thing to really think about as you're moving forward with your disinfectants. So not all disinfectants are the same. When choosing your disinfectants, it's really important to understand which ones are going to be best for your use and for the virus itself. There is an EPA website that we can post that has a list of those that are approved. So one in particular is they're called QUATs, the quaternary ammonium compounds. These QUAT solutions usually need about 10 minutes And this is a flooded surface. So this means that you would want to flood your face cradle or your massage table. You'd want to have that flooded for 10 minutes of time, meaning it's wet, in order for you to have the proper disinfection. Now, if you are also using, and this would be for any surface, so if you are putting things on a table or something of that nature, you would want that table to be wet for 10 minutes. If your clients are sitting on a bench, you want that to be wet for 10 minutes. So as massage therapists, that we will use tools in our practice from time to time. So this could be a T-bar, this could be a gua sha tool, cupping, things of that nature. And in order for those to be properly disinfected, you're going to want to do what's called an immersion method. So immersion is going to mean that the tools you use are in the disinfectant, so in a container that is holding disinfectant for 10 minutes. Clean them first, disinfect them for 10 minutes, pull them out of the disinfectant, and rinse them off, and then put them in a protective place so that they are considered disinfected and ready to use for the next client. Some examples of the QUAT compounds are barbicide, cavicide, opticide, and Lysol. These are the best ones that we can use in our practice and seem to be the most readily available for our purposes. So one of the most common disinfectants that we use in our practices is bleach. And one thing that's really important to understand is that not all bleach is the same. So I'm going to refer back to read the label. With the disinfectants that we're using, you know, bleach in particular has a solution, a dilution solution. So you're going to do 9 parts water to 1 part bleach. And then the biggest thing in order for it to be effective is you're going to need to do a new mixture every 24 hours. You're also going to need to make sure that your bleach has at least 5% sodium hypochlorite to be effective. So even things like Clorox, which is a name brand and kind of like it's the Kleenex of tissues, you know, it's the bleach of bleach. It's important to even look at the brands of Clorox because they will have the different types of Clorox because they will have different efficacies as well. So the one thing that's important about checking your disinfectants is that you can go to the EPA website and they have a list that they are updating for disinfectants to use against the coronavirus. And you can check if the ones that you have in particular work for that. So let's go and fast forward into sanitation and sanitizing. Again, once you've cleaned, you disinfect and then you can sanitize. So sanitizing is just an antiseptic. These are germicides that are formulated for use on the skin. Most of these are going to have an alcohol base to them, and there are some that will help the skin be less drying, or they might add materials to them to be less drying to the skin. But it is important that your sanitizers are 60 to 95% alcohol. Antiseptics, they don't clean your hands. They just of the debris. So again, you have to clean your hands in order to be sanitized, which is a level of disinfection. First clean, second disinfect, and third thing you're going to do is sanitize. So if you think about it from the sense that you're going to clean first, disinfect something, sanitation may only be necessary part of the time in your treatment room. So for instance, you've been working on a client and you're about ready to work on their hands. You may consider using some hand sanitizer on their hand just in case you notice that they touched a different body part or they moved their mask, something of that nature, in which case that level of sanitization would help to break the barrier of the virus that we're talking about.
Amanda, before we move on, I have a question. So I'm a massage therapist. I worked on my client. I'm getting ready for my next client, and we will discuss this more in protocols, but just to add this here, do I need to, before my next client comes, clean, disinfect, and sanitize, or can I just go around with Clorox wipe and wipe everything off?
That's a great question. So I want you to think of your time with your client. So let's say we spend a 60-minute time frame with our clients from start to finish. They come in, we do our intake, they're on the table for 30 minutes. We do a post intake, and they payment, leave, what have you. I want you to think of that entire time frame as your window, let's call it that, right? In which case, you want to make sure for the next client that things are disinfected and sanitized and ready to go. Now, I feel like this is where it gets kind of gray, because we all have so many different types of practices. So if you have a waiting room that has been disinfected, but your client never went in there, it wouldn't necessarily be beneficial to you to re-disinfect something that hasn't been used. If you have poor ventilation and your waiting room is right next door, and your client was, moving around, or you actually had a client in your waiting room as you were escorting somebody out of the treatment room, say you're working in a spa setting or something of that nature, you want to disinfect as often as you can. So disinfection, as I would see it in your treatment room, is just to make sure that it's disinfected for the next client, right? If your clients came in contact with it, or you were coming in contact with it during your session, sanitize. And then after the session, you would disinfect. So considerations for your treatment room and your offices are going to be some of the following things. Designated areas for the proper disposal of your supplies. So for your sheets, for instance, face cradle covers, all of those things, you're going to want to put them into a container with a lid for your soiled linens. If you're taking your linens to a different location, you're going to want to make sure that you have some type of wastebasket liner in there, so that it's easy to remove and take to your vehicle or wherever it is that you're going to be moving that linen to, if it's not lidded. Containers for trash, make sure again that they have a lid, a foot pedal. This will reduce any contact with the top of the lid. So this will reduce that touch. And then during your session, if you should use any type of tool, such as a T-bar, gua sha tools, or cups again, you would want to put them into a container separate, so that you would know that those are items that need to be disinfected. Another idea is to work from a designated station. So if you have a table in your office, you want to clean that area, disinfect that area. You can put a protective cover over the area, like a clean towel or a papered area. And here you can put the supplies that you're going to use during your session. So this could be things like your oil, your cream, your tools that you might be using. If you're providing a mask for your clients, you could put it in that area. These are all items that are going to be session specific. Anytime you use these supplies, so let's say you pick up your oil bottle or you pick up your cream, rather than placing it around the room, which some people do, you're going to place it right into this station, this area. This is going to help you to contain all of your items again. So these are the items that will need to be cleaned, disinfected, and sanitized, ready for the next session, as opposed to setting things all over the room. And those are now the things that also need to be cleaned, disinfected, and sanitized. After your session is over, you're going to remove these items from your designated area, and again, clean, disinfect, and reset your area for your next client. This is just one way to ensure your sanitation during your service and with your clients.
So let me jump in here, Amanda. One of the things that maybe we can clarify for folks is what do you do when you have something on that clean area and you happen not to use it for that client?
Well, anything that you end up not using on your station still is considered session specific, if that makes sense. So meaning you intended to use it with that client, it's already then been exposed to that client, and therefore it is something, a towel that you did not use is something that you would have to put into your soiled linens. In conclusion, taking the proper precautions can really reduce our risk of transmitting any type of disease or pathogen for that matter. And it's just stepping up our game a little bit as massage therapists, as we've been taught universal precautions as our baseline. And these levels of disinfection can really make a difference in our treatment rooms in a time like this.